So I would first also like to just commend the organizers of this event. It has been in, I would say, for me, in equal parts, both sobering and inspirational. So to that, I want to address what we kind of referred to as the herd of elephants, but I'll take one of them, which is from the employer sector, is that the really employers and really global employers should not, nor do I think they intentionally shrink from ensuring the safety of the workplace. So that is an obligation that global employers took on. They've been extremely successful in many sectors. And as you rightly point out, as the workplace changes, as an outsourcer becomes an informal worker, where does that border cross? And what is the accountability of that border cross? I think is something that really needs to be as a major piece of dialogue within the employer world. And in addition, I would ask that there are standards that exist. I'm not a lawyer, I'm a doctor, though I like to pretend, but there are standards that exist, and those standards have to be enforced in order to level the playing field for enlightened employers. So I think, just starting with that existing component, and certainly this meeting has brought up that issue loud and clear. The second area on the inspiring one, and now I put on my MBA hat, which is there's a lot of really good market out here. And what is an informal worker who, Steve Jobs worked out of his garage, and he was an informal worker, and a lot of possibility in regards to the entrepreneurial capability. I can't but think of C.K. Pravahad, the late and great, of sort of the bottom of the pyramid as the Bible here. There is a lot of opportunity for very low-cost pharmacy, low-cost, ergonomic tools that have really come out of this discussion. And I think there's opportunity to think about that. And again, as employers, there's a model that employers and certainly investors use in the U.S. And so I will point again to Silicon Valley, which are these sort of tech accelerators, where you take people with sort of innovative ideas and you put them with mentors and you put them with capital. And it's been a very successful model. And so again, it's one that I could see as kind of working here to kind of think about both opportunity and for all kind of three forces coming together. Additionally, just a couple other points. One obvious place is training. So training of community health workers, training of advocates, and there's a lot of capability within the employer workspace, certainly within the even formalized occupational health and safety environments and communities to really extend that training. I did spend a little time working for insurers as well. I want to comment that people are much more, as to your experience, willing to take risk when there's volume, right? Volume mitigates risk. That's a basic insurance concept. Yep. And so thinking about ways to collectively do that, and again, another kind of mechanism for universal coverage to be able to have collectives and have then employers be able to kind of share that insurance through their sourcing. And lastly, metrics. And so I'm going to make my pitch very firmly for that business metrics be part of any conversation, so that productivity and health and value to the economy, value to the community, value to the consumers is a really important part of this dialogue. It's a really important piece to count so that it continues to have the engagement, not just from corporate social responsibility. Corporate social responsibility is not a tax to make it okay not to do the right things. It's really got to be integrated as part of an economic viewpoint.
Thank you.